gonna try. It's a process.
It's a process.
I finally get to where I want them, and then they leave.
Oh, I'm still on?
2 years.
I call the meeting of the Board of Health of January 7th to order. The first item on the agenda under new business is approval of the minutes as sent of December 3rd, 2025.
Motion to approve.
Second?
Second.
Okay. Minutes approved. The next item on the agenda is the Development Services Monthly Report submitted by Matthew Sheehan, Senior Sanitary Code Inspector. Happy New Year, Matt.
Happy New Year, everybody. Good evening. A couple of things. We had a couple of new businesses open up. One did change hands. We had 3 failed inspections. We did have to close one establishment, New Great Taste Restaurant, 24 Gorham Street. They had some electrical issues in there that was deemed to be a fire hazard. Those issues have since been addressed, thankfully, and they are back in operation. We did have a couple of miscellaneous inspections, Songus Arena Ice Rink inspection, because they still operate. They have one electric Zamboni, and they still have one that has propane. So we have to go in there and test the CO2 levels. They would not allow me to slide across the ice and throw myself into the board, so we were very professional. We were there for a couple hours, and they passed their inspection. We did have one recall for ByHeart baby formula. Went right out to Target. The day DPH sent it over, and what I do is, every time there's a recall, I'll go and look first before I go talk to store staff. Nothing was on the shelf, and the manager of the day stated that they did not sell that product.
Is that the only store that sells it in the
Yes.
city? Oh, okay.
Yes. So I filled out the form that DPH sent it back, so that is all set. Since it is the first of the year, this month, we will start conducting all inspections of our tattoo shops and microblading establishments in the city. And that's about it. That's all I
Hey,
have.
Matt.
And there's a new tattoo artist, is this new?
Yes. And you will be voting to accept that, and that's under, at Lowell, Inc.
Yes, ma'am.
Yep.
Okay.
And one of the, who was it that went out of business? One of them that you called?
That was the piercing establishment that's on the second floor of Central Street. He is not
Professional
going-
body piercing.
Correct. He
Yeah.
is not going to renew his permit. I spoke to him, I think, last week? Yeah,
Yeah,
last
last
week. I
week.
spoke to him last week over the phone, and he stated that, I guess, business is slow, so he's not renewing his permit, which, we'll monitor that. We'll make sure that there is no business going on in there without the permit.
Okay. So I guess on that note, thank you. We'll move on to the body art practitioner
Thanks, everybody.
licenses.
Thank you.
Thank you. The first item on the body art practitioner license is a motion to approve an individual license for Emily Sherburne for working at the establishment Lowell, Inc.
Yes.
And everything's in order for that?
Everything's in order.
Motion made by Dr. Galvin.
Second by,
All those in favor? Aye.
Aye.
okay, and then we have,
The next, yeah, I'm sorry. go ahead.
yep, the regular for all of the body arts, but we do have a few of them who are not in compliance, so we'll just take the ones that are in compliance, and then if the board approves, we can do the other ones and then just approve them like we did last year. And once the rest of, they've paid, and most of the stuff is okay. They're just missing a few minor pieces of paperwork, which we're okay with them continuing to practice. And then when Matt goes in to do the inspection next week, they should have everything in order. And if not, we'll do something about it next week. So we'll just take 2 votes to do all of the ones that are in order, and then a second vote for the other ones, if that's okay with the board.
And what is the AAM certificate?
And where are we looking at that? Madam
So,
Microblading.
Oh,
microblading.
so that is like the gold, I believe that is like the gold standard for what they need for their
That's what they call it,
renewal
the
for
initials
their-
of four,
yeah,
okay.
Yeah, for their renewal.
So it looks like the first person in the practitioners, when it says paid 1216, does that mean that what was owed in the right-hand column was paid?
She's actually paid hers now. So all of the
Okay.
people who owed taxes have all paid. So the only things that are owed right now are minor pieces of paperwork.
Okay.
And it's just getting them up to date. And then
Okay.
a few of them are owed, maybe like BLS during the year. One of them's owed first aid during the year, a few minor pieces of paperwork.
Okay,
So I respect the director's recommendations. I'm not gonna go against them. However, I would like to know,
Yes.
if they're not CPR certified and they're not AAM certified, like, when would you say you're not able to practice? We consider those important pieces to allow them to practice, right?
So when we do the inspection next week, if they don't have it when we do the inspection next week, then we would not allow them to continue
So it's a short grace period they have to become compliant.
next week.
Perfect.
Correct.
Okay.
Yeah. So the grace period would be next week, but then I would say that if Mac goes in the following day and then they have the paperwork, but I don't want to hold them up until the following meeting. So if they get the paperwork to us, say Mac goes out there the 10th, and then they get the paperwork to us for the 11th, I just don't want to say that they can't practice for the full month. I don't
till
want to
next
hold them up.
month's
No, I
meeting.
get that. You start talking about the CPR
Oh,
expires
yeah.
halfway through the year. I'm thinking, well, how long
yeah.
are we letting this go?
So,
That's
right,
all.
so the
I'm fine with
license,
that.
yeah, the license approval would be with the stipulation that these are all up to date before the license is approved.
So in the past, what had happened was we didn't review their paperwork during the year. We hadn't reviewed the paperwork during the year. So we basically closed the chart and put it away.
Yep.
And then at the end of the year, we looked at their chart and then they had been expired for a few months. So what I'm saying is that we can't do that. We need to say to them, you need to come back at the middle of the year and give us the paperwork. So we need to have it as a rolling file and continue to look at these during the year and have them bring it. Or when it's due in January, all of the stuff should be due in January. Yeah. I don't want it to expire and then they don't have it next year and it's been expired for 6 months.
Right, agreed.
Yeah.
Thank you.
You're welcome.
Okay,
So we
any
make a
other
motion?
questions?
So
So do we have a motion to approve the initial, the body art facility renewals for Lowell Inc., Lupo Inc., and Black Sheep Inc.?
Make that motion?
Second? Second?
Ally?
I did.
Oh, okay. Okay, all those in favor? Aye. Okay, motion approved for Lowell Inc., Lupo Inc., and Black Sheep Inc. And then we have body art practitioner renewals, individual renewal licenses for Jorge Maldonado, Eric Johnson, Anthony Stanley, Julio Pastrano, Sambo Yum, Paul Bowie, and Tiago Campos. Or Campos. Excuse me, yeah. And those are all in order. Do we have a motion to approve body art practitioner licenses for those folks?
Motion to approve.
Second?
Second.
All in favor?
Aye.
Aye.
And then we have some individual practitioner licenses up for renewal that are missing some pieces of information. 3 folks from Black Sheep Inc., I Love Beauty, and Heaven's Beauty Corporation, who have pieces of information that are still pending. Is the board interested in doing a renewal of their license with the stipulation that those pieces of information that are missing are submitted before the license is renewed?
So just for my day job, I abstain from this one for Julia and Letitia. So I work on their licensing for the state.
Oh, okay.
I will make that motion to, whatever you said,
Okay.
grant them the month to get in line.
No, so they have until, so their license will not be issued at all until they're in compliance.
Sorry, correct, yes, thank you, yes.
A second.
Second, all those in favor?
Aye.
1 abstained. Aye. And the next item is establishment licenses for I Love Beauty and Heaven's Beauty Corporation. And you're abstaining from,
I do their direct, like their names come across on their direct licenses, so Just to avoid conflict.
For both of these, okay. So we have one abstention. So the motion is to approve the establishments licenses only when the complete list is updated, and they have everything submitted.
I'll make that,
Taxes are paid.
In text, yep.
I'll make the motion.
Thank you. For second, Dr. Galvin, all those in favor?
Aye.
Aye, one abstention. Okay.
I'm talking.
Oh, I'm sorry. Hi, Kathleen.
Did you vote yes, Kathleen?
I said yes to all these things. I don't know if you guys are hearing me.
Yeah, no, we didn't, never mind, I'll be quiet.
Oh, maybe I had it on the wrong thing. I don't know. I just wanna
Okay,
make sure you
so
know
now
I'm still-
now we can hear you. So, your vote is yes for
Yes.
body art facility practitioner and, the pending motions for the practitioner and establishments.
Yes, ma'am. Yeah,
Thank you.
you're welcome.
The next item on the agenda is the Titan lead testing at the Washington School. So if you remember from last month, this came up prior. There was a request by staff to have testing, lead testing.
That is correct. There was some work in the school by DPW, and there was some white film on the floor. One of the teachers got their home kit and tested it and felt that it was positive for lead. So the city got a outside company to test. And in the meantime, while they were waiting for the lead test to come back, they did clean the school and move the kids from that part of the building. But there was a petition by the teachers to have the children removed from the school, and they were very unhappy that the children weren't removed from the school. So I just wanted the copy of the letter and the lead testing to be part of the Board of Health packet, and so that it would be in the Board of Health material in case anybody wanted to look for it. And it all came back negative, and it's all here in case anybody wanted to see it.
I would like, one of the recommendations was just that that the people doing the work have this like lead, OSHA standard. Was that part, like, did we know if there's someone on DPH that, or DPW that has that certificate? So when they're,
I
just so
think-
that it doesn't come up again.
I do believe John Leahy has that, and I believe that was what was talked about at the school committee meeting. When Dave Conway was talking about that, I believe that was something that John Leahy had. But it's been a few months now, so I'd have to jog my memory and go back and read the full report that they had. But since John is a painter,
Right.
that was something that they had talked about, because the school does have some lead paint in it. And that was some of the conversation around that. So if I remember correctly, but don't hold me 100% to that.
Yeah, I think what they're saying is it's recommended that ongoing operations and maintenance plan should be developed. So if there's going to be further work in that particular school, which might disturb the paint,
Right.
then we need a plan that would outline the procedures.
Right.
With someone that
Right.
obviously is certified. Okay. Any other
So
questions?
will
Cole?
those recommendations go to the school? committee?
So this went to the Commissioner of DPW and the,
And I believe it was reported out to the school committee, and I believe it was reported out at the city council meeting as well.
Joanne, can I ask a question about that?
sure,
I mean, so the lead was disturbed when they did some work, or were they painting? I'm confused.
It was not
there
disturbed.
was, so there was no evidence the lead was, or paint, there was no painting done. And there was no evidence of lead being disturbed. There was something they did with the ceiling
Tiles.
tiles that caused dust to
I get you.
get spread. But
Isn't there some kind of process in place before they do any kind of work like that, where they're checking for lead? Am I assuming that is already been done? Is that a standard? I'm not 100%
That might be true
sure.
if they were doing paint, I don't know if it'd be true for ceiling tiles.
yeah, it wouldn't have been appropriate for ceiling tiles, but you're asking if they were going to do painting or something that disturbed the lead, isn't there already a process in place?
Right.
One would
That's
think.
what I'm asking.
Yeah, I would think, but I don't know for sure. But
Yeah,
you would,
because they're asking for a process like that to be in place, so I'm just wondering, I just find it confusing that there isn't already a process in place for that, or,
Right,
you know,
so,
given the age of the
can
building,
clarify
you know what I'm
that,
saying?
so maybe, Madam Director can clarify with, Mr. St. Cyr that there's a process if they were to, disturb the lead, do any painting or anything that would disturb it, that they have that process in place. Okay,
Yeah,
That's fine, yeah.
okay, all
Can
right.
you update us next
All right.
month?
Thank you. The next item on the agenda is the Pride Star Trinity EMS overdose report. It looks like the overdose numbers are the lowest they've been since last February.
Great.
Cyclical.
Did you say cynical?
Cyclical.
No, I was talking about you.
Cynically cyclical.
Any questions on the overdose report?
No, just glad to hear it.
The next item on the agenda is the tobacco control report submitted by Cesar. And as a point of interest in the packet for the tobacco control report is the Mass Cannabis Control Commission approval of final social consumption regulations, which in the future, the board might be worth reading the summary. The board will probably be involved in local control, some local, in additional requirements at the local process to further shape these establishments according to the community's interest around, depending on the interest in Lowell for social consumption sites. Any questions? Okay. The next item on the agenda is the monthly, the department divisional reports. The first one is the public health nursing contact tracing and epidemiology report.
so you'll notice that the public health nursing report was done by Gisella because Nicole Chauncey resigned from the public health nurse manager position. She got married and she's looking to start a family, so she stepped down to take an outpatient clinic position elsewhere. So we have an opening for a public health nurse manager position.
And so for the viewing audience, do you have a salary range, a posting time, or any of that?
So the job was posted today, and the salary range, I believe, was 110,000 to 143,000, I believe, was the top salary, with the 10% above the clinical, with the public health nurses, but somewhere around there. But the posting went up today, so it'll be down 2 weeks from today, I believe.
Okay.
You ready to sign up?
Yes. And everybody has probably heard about the uptick of the flu A cases. And just so people know, the COVID cases today overtook the flu cases in the Maven system. So COVID is on the rise from the flu cases. So
So, as a public service announcement, would you like to note people's options for the flu shot in case anyone who hasn't got their flu shot yet would like to
yes,
get their flu shot?
so the flu shot is. Yeah, so the flu shot is still available. The health department still has flu shots available for people with insurance or uninsured, and we still have COVID vaccines available for uninsured, and it's still widely available. The contrary to public opinion on the media, people who have received the flu vaccine are faring better than those who have not received the flu vaccine with this strain of the flu. So we are probably just about reaching peak flu, but since the kids have just gotten back to school, I would say we'll probably reach peak flu in about a week, maybe 10 days from from Monday. So the urgent cares and hospitals are, I would say, just about popping at the seams, so.
There's no room at the end.
There is, absolutely,
We had
Late on that.
62 admitted patients in our ER hallways the other day.
yeah,
62,
62, yeah.
yeah. It's 2 floors sitting in the hallway.
I worked the weekend and there
That's
were,
terrible.
yeah, there were 51, so, yeah, it was a little,
Yeah, Tufts Medical Center, which is our sister hospital, they have 8 patients on ECMO for the flu.
yeah,
Yeah.
Oh.
We have,
yeah.
You must have a bunch of them, right?
We sent at least 2 out, so it was, yeah, it's a little,
And some pediatric deaths in Massachusetts
Yeah, there
from the
have been
flu,
4
for people that are,
4 pediatric deaths. I was on a call with DPH yesterday, and they believe, they won't say definitely, but they believe that they are unvaccinated. And last year, we had 12 pediatric deaths, and most of them were unvaccinated, so.
get your child vaccinated, it's not too late.
Our kids, they don't.
Not too late to vaccinate, but
I had a question on the Hep B numbers.
yes.
And I think, I can't remember, so the 706 from 2024, and we're down from that to 515.
Correct.
Are these all brand-new cases? Are these like like they can go dormant and then come back? Like, these are all brand-new cases, right?
They should be all brand-new cases, because Maven should weed out the old cases.
Okay.
But they could be people who are new arrivals to Lowell, or,
24 had a lot of the immigrants coming.
yeah,
Right.
so,
25, it was not
Yeah.
allowed.
yeah.
So I wonder if that's part of the difference.
Yeah, I didn't know if there was any like specific, what changed in that time that maybe
yeah.
brought the numbers down a little
Right.
bit, or,
Yeah. So it may have something to do with that. And we had 25 TB cases in 2025, up from
Yeah.
16 TB cases. So just so you know, that was not number 1 in the state. We have been number 1 in the state, but Brockton beat us out by just a little bit, so we were number 2 in the state. But we are number 1 in the Merrimack Valley. So, but right now, we are running number 1 for DOT cases, but we're not number 1 for 2025, so.
So, it may be that the hepatitis B cases are down because we're providing clean needles to the folks in the community.
Correct.
good thing to look at. Numbers matter.
Right. And we were on a call
Well
for,
said, Madam Chair.
we were on a call for homelessness today, and they did say that we are getting 20 more beds at the hotel because of our great data keeping and the fact that we keep track of everything that we do. So they are providing more beds and more services to the area. So data makes a difference.
Next is the school health report. Any questions on the school health report?
So we just hired a new school nurse on Monday, but we do have Ron Moat will be retiring the 20th. He's been with us for 15 years. And then we do have a resignation as of next Friday. She's actually moving out of the area, so they sold their home to take care of in-laws in another part of the state, so we'll end up with two resignations. We were just barely filled.
Didn't you say we were filled like a month ago?
No, we were just barely filled, and now we're, it's okay, we've done a good job. I think we have like five new nurses, so we're doing a good job, but good.
Hi. We doing okay? Okay.
And then substance abuse, so I did Andres' numbers. So his total needle count for this year was 11,479. Last year, he was 15,547. So he's down just a little bit this year from last year.
Because they zoned them out.
He must be slacking.
Or maybe all those old ones from years ago that we were discussing were finally all dug up, and now we're just
Yeah.
to the baseline.
Well, we have less encampments,
Nothing can.
less encampments.
So, the syringes picked up while responding to requests, and the syringes picked up while in the community, that, the 11,000 is the total, including those 5,000?
11,000 is everything they've absolutely picked up, no matter what they're doing. Yeah, no matter what they're doing.
Thank you.
And then we did have the pretty sharps disposal, because this is what we do for our take-back days. So this is just what people do for when we do our take-back days, just for proactively what we take back for what people have, like diabetics, or cleaning out their med cabinets, or whatever it happens to be. So we just did a pretty take-back day.
400 pounds of medication.
Yeah.
Great.
Nice work.
Thank you.
Kathleen, did you have any questions?
No, since you mentioned the needle, syringe stuff, is any new information on that? Or I know they were talking about doing like a subcommittee and all these different things.
Yep.
Anybody hear anything about that?
So, the director and I spoke about it today. So there's a new mayor, and there'll be new assignments, I assume, to the subcommittee. So there'll be new people assigned to the Public Safety Subcommittee, which we're going to be hopefully addressing. Lisa has given the names of the DPH folks to be invited to that subcommittee to the manager's office. And we're waiting for them to schedule a subcommittee meeting. But
Okay.
Lisa will stay on top of that.
Okay, thank you so much for the update.
And the ordinance, not 200 feet from any school, has not taken effect yet, right?
No.
That's still waiting.
Nope.
Okay.
Yep.
Right.
So they're still operating as they were until we sort this out? Okay. Move to adjourn?
Motion to adjourn, seconded. All those in favor, aye. Happy New Year. See you in February.
That was John Donovan.
Okay.
I gotta tell you.
Bye, guys.
Bye,
Kath.
Kathleen.
Hope you feel better.
Thank you, Joanne.
All right, time to go